the average wait time for a diagnosis from the time you have your initial symptoms to getting a diagnosis can be over 6 months.
Diary of a Kidney Warrior podcast in partnership with Kidney Care UK, sharing faith, knowledge, hope, and love.
Hi and welcome to Diary of a Kidney Warrior podcast. I'm your host, Dee Moore. This is the kidney health podcast that shares real stories and expert conversations to educate, empower, and inspire people living with kidney disease and those who support them. Today, I'm joined by Dr. Lauren, a Specialist Training Registrar in Renal Medicine, with a special interest in vasculitis for part 1 of a 2-part interview. We discuss what vasculitis is, how it can affect the kidneys, the symptoms to be aware of, diagnosis, kidney biopsies, and why early detection is so important. I hope you enjoy this conversation. Let's begin. This episode is for educational purposes only and should not replace personalized medical advice. If you have any concerns about your health or symptoms discussed in this episode, please speak with your healthcare professional. Hi, and welcome to Diary of a Kidney Warrior podcast. How are you doing today, Dr. Lauren?
I'm great. Thank you so much for having me.
You're welcome. I'm really excited about our interview today. Today, we're going to be talking about vasculitis and kidney disease. And I'm really excited to hear about how you're going to break down this information to help us understand more about this condition. So yes, thank you for joining me. And I'm really looking forward to our interview. So thank you.
Great. Thank you so much.
Before we begin, can you introduce yourself and tell us a little about your role in renal medicine?
Yeah. So again, thanks so much for having me on the podcast. I'm really passionate about this topic, so it's great to come and have a chat about it. I'm Lauren. I'm a doctor. I work in the Northwest in the UK, in Lancashire. I've been working as a kidney specialist resident doctor for the last 8 years. My role as a kidney doctor really is mainly working in hospitals, clinics, so looking after inpatients and outpatients with all sorts of different kidney problems. During my time training as a kidney doctor, I've done a PhD that was looking specifically at a form of vasculitis, and this has become an area of interest for me, and done some research around this. So hopefully I can try and explain some of the bits and give a bit of clarity on what is quite a complex condition.
So in other words, you know your stuff.
When it comes to kidneys.
So I'm going to start with my first question. And my first question is, in plain language, what is vasculitis? What is actually happening inside the body when someone has it?
So the way I explain vasculitis is in medicine, we have all sorts of fancy words for quite simple things. So vasculitis is actually derived from 2 Latin words. Vasculum, so the vas part of vasculitis means vessel, and the itis means inflammation. So what you have with vasculitis is essentially inflammation of blood vessels. And now we have millions of blood vessels in our body, in all different organs. And we also have blood vessels that are all different shapes and sizes. So we have small blood vessels, medium blood vessels, large blood vessels. And vasculitis is basically an umbrella term. So it just means inflammation of any of those vessels. And then what we do as doctors is we sort of classify it based on the vessels it affects, the organs it affects. And as a result, vasculitis can present with all sorts of different symptoms and can affect all organs in the body, because wherever there's vessels, you can have vasculitis.
So why does it specifically target the kidneys? What's the biological connection?
Yeah, so the thing about the kidneys is the kidneys are full of small blood vessels. So if you think about your kidneys and the job that they need to do, their job is to filter out toxins from the blood. So the kidneys are packed full of blood vessels. So wherever there's blood vessels, there could be vasculitis. Now, with specific types of vasculitis, such as anchor-associated vasculitis, and that's probably one of the more common ones and the one I'll speak about most during the podcast. What happens is the small blood vessels around the kidney, particularly around the filtering stations of the kidney, and we call those glomeruli, can become affected by vasculitis. So you can get inflammation of those vessels, which causes breakdown of the vessels that can lead to damage to the kidney, and then sometimes scarring as well. So we give this a term called glomerulonephritis. You may hear that term. That basically means inflammation of those vessels around the kidney, filtering stations. And then what happens is if those filtering stations stop working, then you can get scarring can form, and then you leak blood and protein and can develop kidney failure. That's essentially what the process becomes.
I know that there are different types. Can you explain what these mean and whether they behave differently when it comes to kidney damage?
So we use lots of terms to characterize vasculitis. And as I mentioned, we mainly characterize it by the size of the blood vessels that are affected. So the small blood vessels is what are typically affected in something called ANCA-associated vasculitis. Now, ANCA are basically proteins that are made by the immune system that mistakenly attacks healthy white blood cells called neutrophils. And this then causes activation of the immune system in a way that negatively attacks the body. Now, we have four main types of of ANCA vasculitis, and these have got different names. So GPA is one type, so that's granulomatous with polyangiitis, and that was some people may have formerly known that as Wegener's. We also have something called microscopic polyangiitis, and that's called MPA. And we have something called eosinophilic granulomatosis with polyangiitis, that's EGPA. And that was formerly known as Churg-Strauss syndrome. And then we also have a condition called ANCA-negative vasculitis, where those ANCA proteins may not be present in the blood. And these are names that are basically given to describe different presentations of vasculitis. So, for example, GPA tends to present with things like more ear, nose, and throat problems. So people may have things like sinusitis, nosebleed, hearing issues, but it can also affect the lungs and kidneys as well. MPA, in contrast, is the most common type of vasculitis that affects the kidneys. And then EGPA is more commonly associated with things like asthma. Kidney damage is less common in EGPA, but can still occur. So all of these different terms are really just to try and describe different ways in which the pattern of vasculitis presents, the organ it typically presents. But it's important to know with vasculitis is nothing's ever as simple as we'd like it to be. And there's a huge amount of crossover. And trying to put patients into single boxes with vasculitis can be really challenging because it's not as easy as this condition equals this. There is quite a lot of variability.
So is vasculitis an autoimmune condition? Is the body essentially attacking itself?
In essence, yes. So vasculitis is basically the body's natural defense system mistaking healthy tissue as abnormal and then targeting the blood vessels. So it is an autoimmune condition, and it is essentially the body attacking itself. What we don't fully understand is what triggers the immune system to dysregulate, to cause vasculitis or to cause autoimmune conditions. And this is true across most autoimmune conditions. We don't fully understand what it is that triggers that sort of cascade of the body starting to misrecognize parts of its body as sort of abnormal, if that makes sense. And we're still doing lots of work on trying to understand that. There's been lots of theories, potentially about environmental triggers or infection triggers, but that bit of our research is still ongoing to fully understand what it is that causes this and triggers it.
I guess that must make working with vasculitis more difficult if you don't understand what the trigger is. And with that in mind, then, many patients say that it took a long time, sometimes years, to get a vasculitis diagnosis. Why is it so easy to miss?
Yeah, absolutely. And this is part of the biggest challenge with vasculitis. Firstly, vasculitis is what we consider a rare condition. It's not super rare, but it's not very common either. And so it's not at the top of patients' radar or necessarily GPs' radar either. And often when you explain to patients that they've got vasculitis, it'll be the first time they've ever heard of it. And that really speaks to its rarity. And you're absolutely right. Unfortunately, some of the biggest challenges we have with vasculitis is that this is a condition that we like to treat early. And the majority of people will have already had a misdiagnosis before being diagnosed with vasculitis. And there has been some research that suggests the average wait time for a diagnosis from the time you have your initial symptoms to getting a diagnosis can be over 6 months. And that's a huge amount of time if we're thinking about organs that are infected from this and this sort of momentum and cascade that the immune system can build without treatment. The other issue is that, as I've mentioned, because you have blood vessels everywhere, vasculitis can affect lots of organs and can present with really varied symptoms. And sometimes these can be quite non-specific. So, it may be that the first signs you have are just feeling more tired, some joint pains, some weight loss. And these can be symptoms associated with lots of other conditions that are potentially more common as well. So it's not unreasonable that people are investigated for other things before they get their diagnosis of vasculitis, but this can lead to delays. And vasculitis is a great mimic for other conditions. So, some of the symptoms may actually sound more like other pathologies or other diseases, conditions. And again, that can sometimes delay getting the diagnosis of vasculitis. So it can be really, really challenging. And often patients feel very frustrated by the time they've got their diagnosis because it's been a really long journey for them. And part of what we need to do then is understand, what's happened to the point in which we're finally seeing them. So it's very challenging.
So while we're on the subjects of symptoms, what symptoms should a patient or their GP not ignore?
Yeah, so that's a great question. So as I've mentioned, a lot of the symptoms can be very sort of varied and sometimes generic. I think any symptom that is persistent or not improving or getting worse is always worth going to see your doctor about and maybe requiring a revisit. So anything that's just, not improving with time, getting worse is important to be reviewed for. Other more specific things with vasculitis are vasculitis can often present with a rash. So rashes are really important. And if you've got rashes, that shouldn't be ignored. Sometimes people can present with some blood in their urine. So if you notice that your urine output has reduced or there's blood in the urine, again, these are things that should never be ignored. And also because we know that vasculitis can affect the blood vessels in the lungs, sometimes people present with coughing up blood. It doesn't necessarily need to be a lot. It can sometimes just be a small amount, but any of those symptoms, we would always recommend that you get seen for urgently.
So are there any other symptoms that patients should be aware of?
Yeah, and again, part of the challenge of vasculitis, like I keep saying, is just the variety of symptoms. I think it's important that we know that vasculitis can affect the kidneys most commonly, and kidney failure is strongly associated with vasculitis. So I guess the key things to be mindful of are the kidneys. People don't experience pain or discomfort when their kidneys are failing, and it's often only when things get really bad that they end up getting a diagnosis of kidney failure. So I always say to people, if you notice any abnormal leg swelling, if you're becoming more breathless, if you've noticed actually your weight is going up very significantly, but you're not eating anymore and you're feeling bloated, these can all be signs of kidney failure. Similarly, severe itch, nausea or vomiting, again, can be signs of kidney failure. So all of these symptoms in combination are not symptoms that should be left and you should be mindful of and speaking to your doctor about as soon as possible.
What tests confirm a vasculitis diagnosis? Is a kidney biopsy always necessary?
Yeah, so the thing with vasculitis is there's no specific diagnostic test. So there's no test that we can do that says, yes, you have this or no, you don't. We do a series of different tests. So as I mentioned before, with something called ANCA vasculitis, which is, again, what I refer to most commonly, that is a test where we check for ANCAs in the blood. So that's a protein that we check for in the blood. Now, these aren't perfect tests because, unfortunately, you can have ANCA measurements that are very high with no evidence of vasculitis. And you can have negative ANCAs, but good going vasculitis. So these don't always correlate well with, disease activity or severity. In some patients they do, but not everyone. So they can't always be used on their own. Other things we use are measures of damage to the kidney in the urine. So we look at blood and protein in the urine. So maybe when you come to clinic, we'll always ask for a urine sample if possible to check for blood and protein. And this normally means if there's presence of blood and protein in the urine, this suggests that there's something wrong with those filter stations that I mentioned earlier, and that maybe the vasculitis is causing some damage to the kidney. We also do different blood tests. So we look for measures of inflammation within the body. So we might check for different signs of that. But all of these tests are really done alongside things like clinical history and examination and the symptoms that are presented, that patients present with. When it comes to a kidney biopsy, you're right, not everyone requires a kidney biopsy. Now, kidney biopsies can be really helpful in some cases because what we can do then is look at the kidney and see how much active vasculitis, how much active inflammation is ongoing versus maybe how much scarring has occurred as a result of previous damage. And this changes maybe how we manage our patients or the amount of immunosuppression that we might to give people. And I'll come on to talk about treatment, I think, in a bit. But if there's mainly just scarring there, then it suggests that potentially the kidney damage has already occurred and there may be not a huge amount we can do about that. Versus if there's a lot of inflammation, if the kidney looks very active, then actually that suggests that maybe we can treat it potentially quite aggressively to try and get that inflammation down and save the kidney from becoming scarred and more damage. So it's not always necessary, but does often give us helpful information. And the thing with the kidney biopsy is that whilst it's a common procedure, we do it very, very routinely on our kidney ward for patients, both as inpatients and outpatients. It is a procedure where there's pros and cons, and obviously they have to be weighed up in individual cases. So it's sometimes that patients aren't well enough for a kidney biopsy, that they have other issues that prevent us doing a kidney biopsy, and sometimes the history, the blood tests are so suggestive of vasculitis, actually, we don't need the kidney biopsy to confirm it. In summary, it's not always necessary, but it does give us a lot of helpful information.
So by the time the vasculitis is confirmed, how much kidney damage typically has already occurred?
Yeah, great question. And again, it can really vary. So some of this may depend on how long the delay has been in patients getting a diagnosis, how much of this has been grumbling in the background and potentially damaging the kidneys before the point in which they get a diagnosis. The rate of kidney damage can really vary as well in vasculitis. So some people can present with very aggressive forms of vasculitis, and their kidney function can decline very rapidly over the course of days and weeks. And this is a term that some people may have heard as rapidly progressive glomerulonephritis. It gets shortened to RPGN. Sometimes you'll see that written places, and that just suggests that this is a quick process. Everything's quite aggressive and things are moving quite quickly. And if that's not treated, then patients can progress to end-stage kidney failure needing dialysis very quickly. In contrast, other people can present with normal kidney function or just slightly impaired kidney function, or maybe just a little bit of protein or blood in the urine that suggests there's kidney impaired, suggests there's something going on within the kidney from vasculitis perspective, but it doesn't have this same sort of rapidly progressive deterioration. And again, what we don't fully understand is why one person could have this very aggressive type and one person could have a mild type. That we don't fully understand. But biopsies in those cases can be very helpful because, again, going back to what I mentioned earlier, if you do a biopsy and there's a lot of scarring there, it may tell you how much damage has been going on in the background for a while versus how much looks quite active and fresh and maybe quite recent.
So really then, it sounds like it is very challenging because by the nature of kidney disease, symptoms don't necessarily present themselves until the kidney function is quite, low. And so then the vasculitis wouldn't be picked up until quite late as well. So it's a case of, obviously, if you catch it earlier, there's more that can be done. So I think it's really a reminder why we're raising awareness of the symptoms of kidney disease. So as soon as you're experiencing any kind of like the symptoms that you said before, the itching, the tiredness, or all of these different things, getting yourself checked out, because what I'm hearing from different doctors again and again is that earlier this is detected, the better, and the more that can be done for patients.
Yeah, that's so true. So I think we always say time is kidney. That's a term you may have heard before. And the kidneys are such an incredible organ. They do so much. We think of them quite simplistically as just filtering out toxins, but they have such a huge role in so many other things. And as a result, when the kidneys don't work, lots of other parts of the body don't work properly as well. And they're very resilient, so they will keep going and going and going until they can't. And it's only at the point where they really can't work anymore that people get symptoms. So I think anything that can raise awareness around symptoms of kidney disease or kidney failure is so important. I think with regards to vasculitis, it's again just really important to emphasize. So kidney failure is one aspect, but patients may present with other symptoms that aren't related to their kidneys that can sometimes be the prompt for investigations that can, allow us then to identify that the kidneys have also been part of that. And we're doing so much more research now within kidney medicine about how we can identify patients earlier, how we can sort of educate the population, GPs, hospital doctors, healthcare professionals of all kinds to recognise patients who may be living with kidney disease, so that, like you say, the earlier we treat them, the better outcomes are. And I feel incredibly encouraged and hopeful about the future of kidney medicine. Where we are today versus 5 years ago versus 10 or 15 years ago is just continuing to improve in terms of what we understand, our access to different medications, the clinical trials that are available. So, the future is very bright for kidney medicine.
Thank you for watching part 1. In part 2, Dr. Lauren explains how vasculitis is treated, the possibility of kidney recovery, dialysis, remission and relapse, and living with vasculitis. Part 2 is available now, so click the link to join us in part 2. Please like, comment and subscribe to Diary of a Kidney Warrior podcast. Until next time, take care and choose to live.
Diary of a Kidney Warrior podcast in partnership with Kidney Care UK, sharing faith, knowledge, hope, and love.